One function is otherwise we jump off the table and fracture our spine. So these are little shock absorbers, helps us to protect the bones. The other and more important purpose of that disc is it creates a space between the bones to let these nerves pass through. These nerves are coming from the brain. This is the spinal cord, passes down through the spine, and between each pair of bones, these nerves go to the various parts of the body. So the nerves that are coming up here are sending messages from the face, the eyes, the ears, the nose, the throat, up to the brain, and the brain is sending messages to those areas from the spinal cord. We get down further to about mid-back, messages coming from the brain and two different organs, the heart, the lungs, right? We get down lower. These nerves are innervating the uterus, the bladder, the kidneys, the bowels. So pressure on these nerves will not only cause pain, but it will also cause those things not to function properly, because there's a block in the communication between the brain and whatever organs those nerves are. Take and turn it sideways. You can picture a donut with jelly inside. The outside is very thick and the inside is a jelly. When that outside portion of the disc tears, that's a herniated disc. And that jelly leaks out, just like you see here in the model. So this disc, the outside has torn, and the inside material, which is a jelly-like material, begins to ooze out. And when it does, it presses on that nerve, the feet. So very often you hear patients who have herniated discs, or bulging discs, or degenerative disc disease, who have sciatica, pain running down the leg. And the reason for that is that disc is leaking and pressing on that nerve that's going down the leg. What happens during spinal decompression is we're able to reverse the pressure in the disc and create a vacuum. When we create a vacuum, we can literally, over time, pull that disc material back in off the nerve. Once we take the pressure off the nerve, the pain goes away, and wherever those nerves are going, to whatever body parts, the signal from the brain is uninterrupted, and it's flowing properly. Very often we see people who come in who have back pain, but they also have other issues. They have problems with bowels or bladder. Or we have women who come in who have back pain, but they're also having difficulty becoming pregnant. They also wonder, is there any connection? Well, the connection is that these nerves, if they're not sending the right signal to the organ and back to the brain, and that communication is blocked, it's not going to function properly. So we're not only about getting rid of pain, which is what most people are concerned about, we're also about restoring normal function and communication between the brain and all the parts of the body. Does that answer your question, sir? Does that help?
So when you have started this, I mean, in India, when you started this business actually, I mean, when you brought this machine and all in India, when you, see how many years you have been doing it?
In 2012, initially
Initially we did research in 2012, we did a couple of years, and formally, like you said, business, we started business in 2019, Anssi Village Farm in 2019. And 19 we had a COVID 2 years.
That's in last 4 years we haven't heard it about it. This is the first time we are hearing that.
But thing is that the people who knew the treatment.
This is the first press conference that we had.
Canada, East Africa, Tanzania, Mozambique, Iraq, Iran, from foreign patients come to India visiting.
So one more thing I would like to clarify here.
Sure.
I don't know, with your permission. Now you say all these things is doing by the machine. So there is no need for doctor or human being anything to do it.
No. I say orthopedic surgeon we have. First, they take almost 45 minutes to check physical examination. Right? They take their medical history and explain it. That means doctor will clarify this candidate for spinal treatment. Right? There are certain conditions. That's a good question you asked. Certain conditions like compression fracture, hairline fracture, tumor, TB infection, we cannot treat. This could be like a 3 to 5% of that condition we cannot treat. But of course, more than 95% cases related to this pathology, those conditions we treat successfully.
The other answer to your question is, we don't put the patient on the machine, push the button, and leave. All the treatments are monitored by physical therapists. They stay with the patient. Every patient is different on this treatment. So what I do is I communicate with our clinical director, and if there's a patient who's having difficulty, we change the protocol. We maybe increase the pressure or change the angle of the treatment. So it's not a one-size-fits-all, push the button and walk away. It's very much dependent on input from the doctor and from the physical therapist. And of course, the patient gives us the best input. Once they tell us what the issues are, then we can make the changes. So I hope that answers your question.
Thank you.
This isn't AI.
This is the original part.
No.
This is a patient who didn't pay their bill.
Thank you very much. Tea and snacks are served here. Doctor and Dinesh will be here. You can continue to ask your questions while having your tea.
सर काय सांगाल एकंदरीत आज आपण हे जे उपचार आणलेले आहेत खूपच फायदेमंद आहेत आणि काय सांगाल एकंदरीत लाईव्ह लोक आमचे प्रेक्षक बघतायत काय सांगाल?
नमस्कार. अन्सा वेलनेस हे पाठीच्या मणक्याचे, मानेचे आणि कमरेचे ओके मान कंबर याचं दुखणं जे आहे भरपूर लोकांना असतं आणि एक रिसर्च पण सांगते की 2050पर्यंत 800 मिलियन्स लोकांना ग्लोबली हा प्रॉब्लेम होणार आहे. नॉर्मली पूर्ण भारतामध्ये औषध, इंजेक्शन, फ्रॅक्शन, सर्जरी हे केले जातात, पण याच्यापेक्षाही वेगळी अशी ट्रीटमेंट अमेरिकेमध्ये गेल्या 35 वर्षापासून आहे, जी स्पायनल डिकम्पशन ट्रीटमेंट म्हणून आहे. डॉक्टर जोसेफ कॅमेरट आहेत, त्यांनी या ठिकाणी केले आहेत, अमेरिकेत आहेत. ब्लू क्रॉस कंपनी जी आहे, इन्शुरन्स कंपनी, त्यांनी $300,000 इन्शुरन्स स्पॉन्सरशिप त्या ठिकाणी होती आणि तिथे ही व्यवस्थित ट्रीटमेंट जी आहे ती भारतामध्ये आपण घेऊन आलेलो आहेत. भारतामध्ये सध्या आता आपले मुंबईमध्ये मल्टिपल क्लिनिक्स आहेत. मुलुंड, कल्याण, वाशी, अंधेरी, कांदिवली, पुणे, नाशिक, नागपूर, हैदराबाद, छत्तीसगड, पंचकुला, प्लस आता दुबईमध्ये उद्या परवा 2 क्लिनिक त्या ठिकाणी, दुबई हेल्थ केअर सिटी आणि जुमारा त्या ठिकाणी आपण क्लिनिक दिली असते. नक्की एकदा जवळच्या क्लिनिक त्या ठिकाणी योग्य सोडून देतील. 8 महिने डिप्रेशन, सर्व ज्या काही कंडिशन काय असते मी भोगलेलं आहे. मुंबईमध्ये 2.5-1 महिने, नंतर अमेरिकेमध्ये 5-6 महिने त्या ठिकाणी तसेच गेलेले आहेत आणि अशी एक अचानक ट्रीटमेंट भेटली ज्यामुळे आणि अर्ध्या तासामध्ये त्या मशीनने ऑलमोस्ट 95% पेन हे ड्रॉप झालं आणि मी ठरवलं की ही मशीन भारतात घेऊन जाणार आणि माझ्यासारख्या किंवा आपल्यासारख्या जे पेशंट्स आहेत, जे त्रासातले आहेत, त्यांना कमी खर्चामध्ये व्यवस्थित ट्रीटमेंट मिळावी, विदाऊट मेडिसिन, विदाऊट सर्जरी. हेच आपला उद्देश आहे आणि पुढे जाऊन मला असं करायचं की पूर्ण भारतामध्ये प्रोटोकॉलच बनला पाहिजे.